Your veterinarian has chosen to use a new life-saving device called a GIF-Tube to enable you to painlessly treat your pet at home. This video is designed to show you how to safely and effectively use this new technique. These are the supplies that you will need to treat your pet at home with the GIF-Tube. The veterinarian will provide you with a bag of subcutaneous fluids, a fluid administration set, a sterile clip-lock cannula, an ointment to apply to the injection port to help keep it sterile, a cover for the injection port. Things you will need from home are a bottle of disinfectant solution. We make this by adding 1 ounce of Clorox bleach to 1 quart of distilled water. You will need a small cup that will hold your bleach solution and a plastic spoon that is used to retrieve caps that you're keeping disinfected in the solution. You will also need some sterile gauze pads to dip in the bleach solution and clean the injection port. The clip-lock cannula that your veterinarian provides may or may not have the protective cap. Just always remember to be on the safe side to hold the clip-lock cannula by the clips. To bring the IV bag back to between room and body temperature, place the bottom 1/3 of the bag in a small bowl in a clean sink. Drape the IV line over a cup hook so that it is raised clear of the sink. Run hot water into the bowl and allow it to overflow. Squeeze the bag to mix and monitor the temperature. Never administer fluids that feel warm to the touch. The following steps will only be necessary when using a new bag of fluids. Always use a new IV set with each new bag. After disinfecting your hands, open the IV set, leaving both end caps in place. Remove the protective sheath over the IV port on the plastic IV bag. Remove the protective cap from the IV set spike without touching the spike. Hold the roller clamp and move the roller to the close or roller down position. Insert spike into port on IV bag. Force in as far as possible. Hang the IV bag above the level of the patient. Compress the drip chamber and release. Allow it to fill 1/3 to 2/3 full. Remove the cap from the other end of the IV set. Drop cap in bowl containing a small amount of diluted bleach. Release pressure on the roller wheel, allowing a small amount of fluids to flow. Open the purple clip-lock cannula and carefully place on the end of the IV set. It's important to remember, whenever removing or replacing the purple injection port cap, to always turn clockwise to prevent loosening the injection port itself. This is Samson, who has chronic renal failure. Samson has had the GIF-Tube in place for over 5 months. Christy is going to now demonstrate Samson's treatment. Twist clockwise or pinch off the purple injection port cap. Place in bleach solution. Clean the rubber portion of the injection port thoroughly with a diluted bleach-soaked gauze. Place the gauze between the port and the skin. Open the clip-lock cannula package. Remove the cover from the clip-lock cannula if there is one in place. Re-sterilized cannulas may not be covered. Be careful to hold by the wing so as not to touch the injection tip or the opening that connects to the IV line. Connect the injection port to the IV line. Plug the cannula into the injection port. Open the IV line all the way and administer the amount of fluids recommended by your veterinarian. Turn off the fluid flow. Unplug the clip lock cannula from the injection port of the GIF-Tube. Remove the clip lock cannula from the IV line. Recap the IV line with its cap, which has been in a bleach solution. Reapply the antibiotic ointment to the injection port. Replace the port cap on the injection port. If you only push the injection port cap on about 2/3 of the way, it can be easily pinched off when it's time for the next treatment. Congratulations on the successful treatment of your pet with the GIF-Tube. Your veterinarian is trained to answer any further questions concerning this procedure. To keep up with the latest information about the GIF-Tube, visit our website at www.practivet.com.